Vitamin D deficiency affects around 1 in 5 adults in the UK, and that number rises during the winter months when sunlight is in short supply. So, there are 3 things that you need to know about it. How do we get vitamin D into our bodies? Number 2, what happens when levels drop too low? And lastly, how do we treat it? Okay, the body produces vitamin D naturally when skin is exposed to sunlight. In the UK, from around late March to the end of September, most people can make enough from time spent outdoors. Now, from October to March, sunlight is too weak for that to happen. This is why supplements are recommended during those winter months. Food sources also help, but only so much. You've got examples like oily fish, egg yolks, red meat, and liver. These all contain some vitamin D, and also certain foods are fortified with it. But diet alone is rarely enough to maintain good levels. So, if you're not already taking a vitamin D supplement through the winter months, that's the first step. Pick one up from any pharmacy or supermarket. They're super cheap and widely available. Now, certain groups of people should supplement all year around regardless of the season. This includes pregnant and breastfeeding women, older adults, people who spend very little time outdoors, people with darker skin tones, because higher melanin levels reduce the skin's ability to produce vitamin D from the sunlight. Also, you've got people with conditions that may affect how the gut absorbs nutrients. So you've got conditions such as Crohn's disease. This is basically a long-term inflammatory bowel condition. So, what does vitamin D actually do? Well, vitamin D plays a central role in bone health. So in kids with severely low levels, their bones can become really soft and weakened. This is known as rickets. It can also cause bowed legs and delayed growth. Now, in adults, severely low levels can lead to osteomalacia. This is basically a condition that causes the bones to be really soft. It can also cause conditions such as osteoporosis. This is basically where the bones become really fragile and they become more likely to fracture. Now, most cases of vitamin D are treated well before they get to this point. Now, beyond our bones, vitamin D also affects our muscle, strength, immune function, mood, and energy levels. You see, it's got quite a broad range of impact, and that probably explains why symptoms of vitamin deficiency can feel really vague and feel really hard to pin down. But I guess if you're aware of what it affects, you can maybe link that to some of the symptoms that you are currently having if you are deficient in vitamin D. Now, the most common symptoms that we see in clinical practice are persistent tiredness, muscle aches, and also a low mood. Now, if a blood test confirms low vitamin D, most people can correct this with standard over-the-counter supplements. Now, a very small number of patients with very low levels may require a higher dose prescription from your GP. Now, your GP will guide you on what applies in your particular case. So just to summarize this, vitamin D deficiency is really common in the UK, particularly through the winter months. It affects your bones, your muscles, your mood, and your energy levels. The good news is that it's really easy to address this. If your levels are low, picking up a supplement from your local pharmacy is all that most people need to get back on track. And in some cases, if severely low, your GP will prescribe you some higher strength vitamin D supplement. Hope you found this helpful. Until the next time, speak soon.